Millions of people with original Medicare are in the 6 states where WISER, which stands for Wasteful and Inappropriate Service Reduction, launches January 26. CMS selected 17 categories of outpatient services for this program. It's not random. These are high-cost, high-volume services where CMS found concerns about improper payments, according to the Federal Register notice from July 2025. There are 17 categories, 5 groups. I will show you how to know if any of them affect you and exactly what to do if they do. Hi, I'm Hanh Brown. This is AI, Policy, and Aging Collide, and where your family fits into all of it. So let's get into the list. Category 1, nerve stimulators. There's 4 types at launch. These are implanted services that use electrical signals to treat chronic conditions: chronic pain, urinary incontinence, sleep apnea, Parkinson's, and tremor. Deep brain stimulation for epilepsy and treatment-resistant depression is on the selected list, but CMS has delayed its implementation. And this will not require prior authorization when the model begins January 2026. And if your doctor has recommended any nerve stimulator for these conditions, check whether it is active at launch. These devices often cost tens and thousands of dollars, which is why CMS is looking closely at them. Category 2, spine services. There's 4 types: spinal cord stimulators for chronic back pain, cervical fusion for neck pain and disc disease, percutaneous image-guided lumbar, decompression, a minimally invasive procedure to relieve pressure on lower back nerves for spinal stenosis, vertebral augmentation, a procedure to stabilize fractured spine bones, and compression fractures. So if you have chronic back pain and your doctor is recommending surgery for an implant, these are numbers 6 through 9 on the list. Back pain services are among the most common and most expensive in all of Medicare. There's category 3, injections and devices. There's 4 types: epidural, steroid injections, one of the most frequently performed pain services in Medicare; hypoglossal nerve stimulation for sleep apnea; incontinence control devices; impotence treatment devices. Category 4, wound care. There's 3 types: skin and tissue substitutes for chronic wounds, bioengineered skin substitutes for lower extremity chronic non-healing wounds, cellular and tissue-based products, also called CTPs, for lower extremity wounds. If you or a parent has diabetes with foot ulcers, pay attention. Wound care products are a major Medicare expense and one of the categories where CMS has found billing concerns. These products can cost thousands of dollars per application. So if your doctor recommends these wound treatments, WISER will be reviewing that. Category 5, knee. There's 1 type: arthroscopic lavage and debridement for osteoarthritic knee, that is flushing or cleaning the knee joint for osteoarthritis. This is a common service, but research has shown mixed results for some patients. So CMS is looking at whether it is being used appropriately. You see, that is all the 17 categories, with 16 active at launch and deep brain stimulation is delayed. So these are non-emergency outpatient services. Emergency care and inpatient hospital stays are not affected. So now, how do you know if any of this actually affects you? There are some questions you should ask. 3 questions. Answer them out loud as I go. If you answer no to any of these questions, the program WISER, Medicare Wasteful and Inappropriate Service Reduction Program, it does not affect you. So you don't have to worry. All right, so question 1. Are you on original Medicare? That means Part A and Part B, the red, white, and blue card, not Medicare Advantage, not private plan. If you have Medicare Advantage, you can stop right here. WISER does not affect you. Your plan already has its own prior authorization process, and it has for years. And if you are not sure which type of Medicare you have, look at your card. If it says Medicare Health Insurance with your name and Medicare number, you have Original Medicare. If it has a private insurance company name on it, you likely have Medicare Advantage. So if yes, you are on the Original Medicare. So continue to question number 2. Do you live in or see doctors in Texas, Ohio, Arizona, New Jersey, Washington, or Oklahoma? Well, these are the 6 states in the WISER pilot program. CMS chose them based on several factors, including having enough patient volume to measure results and historical spending patterns on these services. If your answer is no, then WISER does not affect you, at least not yet. The program may expand after 2031, after CMS evaluates the results. But for now, the other 44 states are not included. Now, let's say if your answer is yes, continue to question number 3, which is, do you need any of the 17 categories of services I just showed you? So look back on the list. We had nerve simulators, spine services, injections and devices, wound care, knee services. So if your doctor has not recommended any of these, WISER does not affect you, at least for now. And you are in a WISER state, but your services are not on the list. If yes, your doctor has recommended one of these services, then WISER applies to you. Question number 3, that is a checklist. Most people worried about WISER will answer no, at least one of these questions. Well, that's the point. This program affects a specific group in 6 pilot states, not everyone on Medicare. You see, 4 things that trip people up. First, the provider location rule. WISER applies based on where your doctor is, not where you live. If you live in California but see a specialist in Arizona, WISER applies. Arizona is a WISER state. California is not. If you are helping a parent who snowbirds between states, ask where their doctors practice. That is what truly matters. So second, the Medicare Advantage question. Can you switch to Medicare Advantage to avoid WISER? Well, no, that does not solve the problem. Medicare Advantage already has prior authorization, often more expensive than WISER. You would be trading one review system for another. Plus, you may lose access to your current doctors if they are not in the new plan's network. So switching is not the answer. Now third, what about emergencies? Well, emergency care is excluded from WISER completely. If you need emergency services, let's say heart attack, stroke, serious injury, WISER does not apply. No prior authorization, no AI review. You get care immediately. Now, according to Medicare.gov, Medicare covers emergency services when you have symptoms that require immediate medical attention. Well, that protection remains in place. WISER only applies to planned, non-emergency outpatient services where your doctor schedules a service in advance. Now, fourth, well, what if WISER does not affirm your service? Well, you have appeal rights, and that's really important. If Medicare or the WISER review process does not affirm coverage for a service, you can appeal that decision. According to Medicare and You 2026 document, you can appeal if Medicare denies a request for a healthcare service that you think should be covered. Well, here's how it works. You file an appeal with Medicare Administrative Contractor. That's a company that processes Medicare claims in your region. Their name is on your Medicare summary notice, the statement Medicare mails to you after you receive care. Now, you can use the form CMS 20027. You can get this form from Medicare.gov or by calling 1-800-Medicare. So you generally get a decision within 60 days. Now, during that time, keep copies of everything. Every letter, every form, every conversation with your doctor's office. Write down names, dates. Ask your doctor for supporting documentation. A letter explaining why this service is medically necessary for your specific situation can strengthen your appeal. Your doctor knows your case. Their documentation matters. Your appeal rights are not going away. They are built into the system. And if the first appeal is not successful, there are additional levels, including independent review by people who were not involved in the original decision. So, if WISER applies to you, here's exactly what to do. Step 1, save the service category list from this video. Screenshot it, print it, take it to your next appointment. Know which of these 17 categories your doctor is recommending. Step 2, ask your doctor which pathway they will use. The video 1, this is video 2, cover the 2 options, prior authorization before the service or post-payment review after. Your doctor chooses the pathway. You should know which one they are using and why. If they choose prior authorization, the review happens before your service. You will know whether it is affirmed before you go in for surgery. If they choose post-payment review, the service happens first and the review comes later, which means there is a chance that Medicare could not affirm payment after the fact. So ask your doctor these specific questions. Which pathway are you choosing? Why that one? And what happens if the review comes back with questions? Will I be responsible for any costs if there is a problem? Well, these are fair questions. Your doctor should be able to answer them. Step 3. If you cross state lines for care, confirm where your provider is located. Remember, WISER applies based on provider location, not where you live. Step 4. Know who to call if you have questions. For general Medicare questions, there's 800 Medicare. They can explain your coverage and your rights. Now, for free personalized help, contact your state health insurance assistance program called SHIP. Every state has one. They should provide free counseling to help you understand Medicare and navigate the system. They can help you file an appeal if needed. And to find your state's SHIP, visit Medicare.gov and ask for your local SHIP number. So if you are planning a service for, let's say, January 2026 or forward, have these conversations now. Don't wait until you are, let's say, ready to schedule. So which of the 6 states are you in? Drop it in the comments. So now you have the list, 17 categories of services, 16 active at launch, 5 groups, 3 questions. Most people worried about WISER are not actually affected. They have Medicare Advantage, or they are in one of the other 44 states, or they do not need specific services. So if you are affected, if you answer yes to all of the 3 questions, well, now you know exactly what is on the list, what to ask your doctor, and who to call if you need help. Your appeal rights remain intact, emergency care is excluded, and you have resources like SHIP to help you navigate the process for free. Now remember, WISER, that stands for Wasteful and Inappropriate Service Reduction. It's not about being afraid of the system. It's about understanding how it works so that you can advocate for yourself or help a parent do the same. You see, knowledge is how you stay in control. So did you pass all 3 questions? Well, put yes or no in the comments. If you spend hours trying to figure this out before finding this video, well, I understand. I'm building a tool to answer Medicare questions like this instantly. Plain English with sources and citations. Put in the comment, Medicare Brain. So the next video answers the question I hear most. Who is actually making these decisions? What does the AI do? And what do humans decide? I'll break down exactly how the review process works. So subscribe, you don't want to miss it.